Okay, welcome to the Friendly Neighborhood Oncologist. I'd like to send a special shout out to everybody in the community who wants to immerse in the Oncoverse. If you're not part of that community yet, feel free to subscribe. It's free. I'll never direct message you. Go ahead and smash that like button. Hopefully I'll get into that YouTube algorithm. And I'm a board certified medical oncologist. I practice in one of the large metropolitan areas of the United States in the suburbs. And it's not far from a top medical school and a top academic cancer center where I did significant amounts of medical training. On a daily basis, I help my patients kick cancer in the you-know-what. And because there's a lot of information, but also a lot of misinformation out there, the purpose of this channel is just to connect interested people to free resources that are regarded as a gold standard of care. As a caveat, I am not your particular medical advisor. Please seek out your own board certified physician. Nothing I say should be construed as a medical opinion, diagnosis, or recommendation for staging or treatment. This is just referring folks to gold standard of care resources that happen to be free. All right, well, I have had some requests for prevention and screening in colorectal cancer. So without further delay, let's get underway. This is the NCCN Guidelines, again, the National Comprehensive Cancer Network Guidelines. This is a free resource that you can go to on nccn.org. They have guidelines for physicians and also for patients, divided up by solid tumor type. I am not a medical or legal representative of the NCCN. I'm simply pointing folks out to an excellent resource. So I'm also commonly discussing, primary and secondary prevention of colorectal cancer with our patients. So again, lifestyle and diet, regular physical activity has been associated with decreased colorectal cancer risk. A diet high in fruits and vegetables is associated with a decreased risk in some studies, and they cite two in particular in their appendix. There is some evidence for the protective effect for aspirin in colorectal cancer development if taken for at least 5 to 10 years, and thus the U.S. Preventative Task Force endorses low-dose aspirin for individuals age 45 to 59 with a greater than 10% 10-year cardiovascular risk. And again, patients should consult their own doctor, take into account risk for bleeding, life expectancy, long-term compliance. And the whole point is that the COX pathway has been associated with development of certain adenomas and the adenoma to carcinoma sequence. So by blocking the COX pathway with aspirin, that was the rationale for these studies. In terms of other lifestyle dietary factors associated with increased colorectal cancer, long-term tobacco is associated with colorectal cancer risk. Long-term consumption of red meat and processed meat is also moderate to heavy alcohol consumption, obesity, and even low vitamin D. So again, a diet low in saturated fat and cholesterol, high in fruits and vegetables, low in red meat, low in processed meat, limiting alcohol consumption, avoiding tobacco use, avoiding obesity are all positive things to do to decrease the risk of colorectal cancers. So in terms of screening, currently the NCCN does recommend screening colonoscopies for patients in the US, even without any symptoms or any family history. And of course, family history, prior history of cancer, symptoms would, of course, take precedence for folks who are less than age 45. And again, the previous guidelines were based more on studies, particularly studying people who were greater than or equal to 50 years of age. But because of modeling, statistical analysis showing an increase in the incidence of colorectal cancer in patients in their 40s by roughly 30%, that led to this recommendation. So again, prevention and screening so that the disease never develops or develops in such an early stage that patients are put in remission with surgery and lifestyle changes and surveillance. All right, well, thanks everybody for tuning in. Thanks to folks for the suggestions for more prevention and screening. And this is the first video on the colorectal cancer section. Thanks everybody. And we'll catch you soon.